name is Debbie Bell, and on behalf of the Franklin County Health Department, I'm pleased to welcome you to Working on Wellness. Today, we are out in our community today, and we're visiting one of our wonderful partners at the Kentucky Retirement Systems. Joining me now is Sally Brunner, the clinic supervisor for the Franklin County Health Department and part of our health department's Humana Vitality team. Welcome, Sally.
Hi, Debbie. How are you?
I'm doing great, thank you. Can you tell us a little bit about exactly what the Humana Vitality Assessment Worksite Wellness Program is?
Sure. The Humana Vitality Assessment is a collection of different parts of health information. We can do height, weight, blood pressure, check your waist circumference, and we can identify a couple things from that. We also do a finger stick where we get a little specimen of blood that can identify some factors about your blood tests, about cholesterol and glucose, things like that. And then we can continue with telling you more and more about how your levels that are identified on your assessment can be improved or
all that great stuff, isn't it? Yeah. Well, this Humana Vitality Assessment, this is fairly new to our health department. Now, as I get older, everything's new if it's within the last 5 or 6 years. Right. But how long have we been working with different work sites to share this information with employees?
It has been a couple of years, so we've been able to make some return visits to different sites where people work. So it's been a real enjoyment, to be able to connect with different people in the community and educate them about the health assessments.
Most of the state employees are familiar with the fact that our insurance carrier changed this year. We're no longer Humana. We are now Anthem Blue Cross Blue Shield. However, Humana still has a very significant presence with our wellness plan. Right. So with that said, these assessments are absolutely free to all employees participating. Can you tell us a little about that?
Yes, the assessments are paid for. The information we gather, we bill the Anthem insurance, so the employer and the employee don't have to pay anything out of pocket. And that's really an advantage. You don't have the office visit to the doctor. Perhaps you can do this during the work hours where you don't have to take off work to go to the doctor. But the assessment values are put into Anthem's system, and it's just a much more convenient and cost-effective way to do that.
Now, you talked about how we are able to, come out to the work site and perform these clinics while the employees are on the job. Mm-hmm. I just, rolling around in my head here, I think about a lot of barriers that are eliminated to, people initially having this check. Mm-hmm. So can you tell us just step by step what their visit would look like for a Humana Vitality assessment?
Yes, and it's the same here as it would be in the clinic. So and just to let you know, we can do this also if they do choose to come to the health department clinic. But what it includes is basically a height, weight, blood pressure. Then we check the waist circumference, and those are documented. They get a little finger stick for a blood draw that identifies their cholesterol and their glucose levels. And then they speak to the nurse who's counseling them on what those numbers mean or what this all could mean to help them improve their health or maintain their health. They may be absolutely perfect, and that's what we like to see.
Definitely the gold standard. Of course, our mission with the Franklin County Health Department is to prevent, promote, and protect the health of our community. So it does wrap it all up in one. Now, have you maybe speak to the fact that when they receive their results with us, mm-hmm. if there is an issue that is maybe something that's brought to light mm-hmm. during their visit with us at that time, as brief as it may be, does that counseling include the possibility of taking those results further back to a healthcare provider?
Yes, we do make referrals to their physician, or we talk to the employee, the person receiving the test results, how important it would be for them to follow up with their doctor. But it's my understanding that because this information is placed in their insurance profile, their assessment profile for Humana Vitality, that those parameters and values are probably, they're getting more counseling through Humana's system. So, and their doctor is definitely involved, so that they can address any issues and keep things healthier. So
Now, this traveling to the different work sites for employers that have employees participating in the Kentucky Employees Health Plan, are you noticing that is picking up or catching fire, if you will, more and more organizations or businesses contacting us for these clinics?
Yes, they are, and we've been quite busy over the past several weeks. Since January, actually, we've been going out, if not once a week, twice and 3 times a week. So there's a team of actually 4 people. We call them our vitality team from the health department. They've gotten so good at accomplishing these events and keeping people moving so that they can get back to work. It's an efficient system. So we've got it all organized.
That's terrific. Now, you talked a little bit about if we aren't visiting these work sites, individuals can come and visit us in our health department clinic. Now, is it solely for individuals with Humana Vitality or participating in the Kentucky Employees Health Plan, or can someone outside of that system come in?
That was a question that was brought to us not too long ago, and so we have looked into that, and we're able to do the same service for individuals for a flat fee. I believe it's around $60, and that's probably less than they would have it done maybe somewhere else, on an individual basis, paying test for test and that type of thing. But it's definitely something that some people have brought to us before. I don't have that insurance. I work there. I'm under my husband's insurance or something, but they wanted to participate as well. So yes, it can be done, and it can be done at the health department, like I said, as well. So through the health department, we probably could investigate whether their own insurance company could be billed for it. So there's definitely options there.
Well, that's terrific. And some of those markers that you were discussing, that are being checked when they come in for these Humana Vitality assessments, those are things that we're looking at as far as prevention of chronic disease. So as you were saying, if you have someone with a clean slate, all of their values are within normal limits, it still isn't the past to, right. Just, to not be aware of your health. But it's just it gives you great benchmark numbers and lets you know that you're on the right track to staying healthy.
You can actually celebrate that too. I mean, it's something that you can, to feel really good about. So.
Wow. Well, if I had another work site that was interested in working with you on getting these clinics in your work site or in their work site, who would they need to contact for that?
They can call the Franklin County Health Department, and any of us will be able to steer them in that direction.
Terrific. Can you think of anything else that our community needs to know?
This has been a great opportunity to come out here, and we do thank the employees here at the retirement system for having us.
Thanks, Sally. Liza Welch is joining me now, an employee with the Kentucky Retirement Systems and a participant of the Humana Vitality assessment checks here at her workplace. Hi, Liza.
Good morning.
Thanks for being with us this morning. I wanted to talk to you a little bit about when you had your Humana Vitality assessment here at your workplace. Can you tell us a little bit about it?
Yeah, it's great. I didn't have to do anything special. I just came to work and was able to come in and do my check with the health department and answer their questions, have my assessment done, and get my information on the spot.
Now, the checks that you're talking about, what was involved with that, and how much time did it take?
They did weight and height measurements, blood pressure check, and then took a little blood and got some information from that about my my blood glucose levels, my cholesterol, and then I sat down with a member of the health department and they went over my information with me, did a little health coaching, and told me what things I might do to improve my numbers, and went over the numbers that needed improvement.
That's a really terrific bit of information and nice to be able to have that during your workday.
Yeah, it really was.
Thank you so much for joining us.
Thank you.
Joining me now are Marlene Robinson and Mary Coleman with the Kentucky Retirement System. Good morning, ladies.
Good morning.
Good morning.
Thank you for agreeing to speak with me this morning and share a little bit of information about your worksite wellness program and your partnership with the Franklin County Health Department. I thought we'd start our discussion by talking a little bit about how you came about the partnership with the health department and looking at these Humana Vitality assessments for your employees.
Okay. Kentucky Retirement Systems has used the health department for many, many years to do flu shots every fall. And then when Humana Vitality was offered and we were asked to coordinate with the health department to do the biometric screenings, it was just a natural progression of a relationship we already had. So it's worked out wonderful, and they have taken splendid care of us and our team. So we have no problems calling them, and you come out whenever we do.
Well, you all have been a joy to work with. I know I've been at a couple of your all's health fairs and so forth, so it's been nice, and the employees have come out to support that. Now, Mary, can you tell us a little bit about how the employees have viewed these Humana Vitality assessment clinics?
The employees have been really receptive to the employee vitality checks. We run on an average, especially in the fall. We usually end up having at least 40, almost 50 employees who do the vitality checks, which is a great number of employees. And we do 2 clinics, vitality clinics, in the fall for our employee wellness, health and wellness fair, along with the flu shots. The employees keep up with their results, often inform me of if they've had any changes in their results. So they're very health conscious and keep up with their results, come to me if they've had any changes in their blood pressure. So the employees here at Kentucky Retirement are very health conscious. Sometimes it's surprising how health conscious they are. And this year we've had 2 health vitality checks this month, averaging 20 employees each time. So the employees continue to be health conscious and wanting these clinics to go more often than not.
Now, what would you all say has been the greatest benefit of the vitality assessment checks?
One, that they're free, and the employee can come during their work time, and they don't have to worry about trying to fit it into their work schedule. They're allotted the time to come down and get checked and get their results on the spot, which is a great asset for them.
Super convenient, and like she said, when they get the results, many of them will take them directly to their healthcare providers, and then they have a jumping off point to have that discussion. This is my results, this is the coaching I got, and then they have a record and can move forward with their healthcare provider. But we make it as convenient as possible for our team.
That's
And
wonderful.
completed their Living Well promise.
Yeah.
That is very important. They have through the beginning of May to get that done. So having that flexibility and, you eliminate that barrier of having to take off work to go and have those values, assessed. So it truly is a wonderful commitment by the employer that we are seeing. Now, given these results and the number of employees that you have coming through, are there any additional worksite wellness initiatives that this has maybe spurred for you, or any ideas to build on that maybe in the future that you've thought about?
Well, as Mary said, she does the blood pressure clinics usually once a month, so that's been great. We do the flu shots in the fall. Mary coordinates a health and wellness fair every September, so we bring in a lot of vendors plus the health department. We do, with Kentucky Employees Assistance Program, we often will bring them out for classes on stress awareness, time and management, those types of things. Anything that is provided or offered to us, we try to jump on board and have it out here at our site so that, again, it's super convenient for our employees to take advantage of. And the best thing we could say, it's great when you're walking down the hallway and you see people having conversations about it, of course keeping everything confidential that needs to be confidential, but when you see people discussing their cholesterol or blood pressure and getting engaged, and they go home and they talk to their family members and try to find out their family history, I think that's a great compliment to the program.
That's terrific, ladies. Thank you so much for sharing this information with our audience, and thank you for what you do for your employees.
Thank you.
And we'd like to thank the health department for cooperating with us and coming out.
Thank you all.
Thanks.
I'd like to take the time to thank our friends here with the Kentucky Retirement System for allowing us to come out for their Humana Vitality Assessment Clinic. I'd like to thank you for tuning in, and I hope that you'll join us next time for Working on Wellness. I guess we're off to our next destination. I'll see you next time.